Milk Thistle, printed in Stat Pearls, NCBI bookshelf. The authors are Ted George Achufusi, Mark Pellegrini, and Raj Patel. The last update was February 28, 2024. Continuing education activity. Herbal products have gained considerable popularity among individuals grappling with chronic diseases. Among the herbs available, milk thistle stands out as a centuries-old remedy used by herbalists and clinicians for diverse liver ailments such as fatty liver disease, hepatitis, and cirrhosis. Milk thistle's efficacy in shielding the liver from environmental toxins has contributed to its widespread adoption, with millions incorporating milk thistle into their routines to bolster healthy liver function. This course discusses the research surrounding Silymarin, an amalgamation of flavonoligans derived from milk thistle, focusing on psilocybin as its most active component. The discussion will center on elucidating the mechanism of action, outlining the adverse event profile, detailing monitoring procedures, and exploring relevant interactions associated with milk thistle. The insights shared are invaluable for interprofessional team members involved in the care of patients where milk thistle may offer clinical benefits. Objectives: identify the various clinical applications of milk thistle, including its use as a complementary therapy for liver conditions such as hepatitis and cirrhosis. Apply evidence-based guidelines for using milk thistle, ensuring its integration into patient care is based on current research and recommendations. Assess the effectiveness of milk thistle in individual patients by monitoring liver function tests and other relevant clinical parameters. Develop effective communication with patients about milk thistle's potential benefits and limitations, addressing their questions and concerns. Access free multiple choice questionnaires on this topic. Indications. Herbal products have become increasingly popular, especially among individuals with chronic diseases. Herbalists and physicians alike use the milk thistle, Psyllium marinum, an annual or biennial herb from the Mediterranean region, for hundreds of years to treat a wide range of liver pathology, including fatty liver disease, hepatitis, and cirrhosis, and to protect the liver from environmental toxins. Today, millions of people consume milk thistle to support healthy liver function, and the rape seeds are primarily the medicinal part of the plant. Researchers have focused on the efforts on studying silymarin, a mixture of flavonoligans extracted from milk thistle, and the active ingredient of this extract. Silymarin and psilocybin have become some of the most prescribed natural compounds, and the two names are often interchangeable. However, each has a different clinical purpose, and there are no definitive results in terms of clinical efficacy. Currently, healthy products such as milk thistle in the United States are not considered drugs and do not have the same level of regulation as drugs from the U.S. Food and Drug Administration or the FDA. Like most herbal products, the FDA does not approve or recommend milk thistle as a treatment for any medical condition. Recent studies have focused on the role of milk thistle in preventing non-alcoholic fatty liver disease, a common hepatic manifestation of metabolic syndrome. The relevance of NAFLD in Western countries is approximately 20 to 30%. Currently, there's no consensus approach when it comes to the treatment of NAFLD. Most clinicians approach the disease by emphasizing lifestyle modification, including diet, weight loss, and limiting alcohol intake. However, study results suggest milk thistle can benefit patients with NAFLD, and data indicate that silymarin treatment correlated with reduced insulin resistance and decreased fasting insulin levels significantly. Patients treated with 600 milligrams of silymarin for 12 months demonstrated lower fasting insulin levels, and a separate clinical trial evaluated silymarin's effectiveness compared to metformin and pioglastone in NAFLD patients. Research showed that patients treated with the silymarin had significantly lower transaminase levels than those treated with metformin or pioglastone. In a sample of 25 patients treated for 4 months with 200 milligrams 3 times a day before meals, there was a significant reduction in blood glucose levels compared to an increase in the placebo-treated group. In the same period, their HbA1c levels also dropped by an average of 1 point, and the same group of patients also demonstrated significantly reduced total cholesterol, triglycerides, and LDL levels. Another study aimed to evaluate the efficacy of combined treatment, which includes vitamin E, psilocybin, and phospholipids, and demonstrated that this complex improves the liver damage, especially markers of liver fibrosis and insulin resistance. In Europe, the intravenous preparations of purified milk thistle are approved as an antidote to Amanita phalloides, a mushroom toxin that causes severe liver damage. Early lab studies suggest that milk thistle and other active molecules in milk thistle may exhibit anti-cancer effects, including interfering with cancer cell division and reproduction, shortening cancer cell lifespan, and reducing the blood supply to tumors. Other research suggests milk thistle acts synergistically with chemotherapy. Other research is necessary to determine whether milk thistle can exhibit this activity in vivo. Mechanisms of action. Milk thistle exhibits its hepatoprotective properties by 3 major mechanisms: as an antioxidant, as an anti-inflammatory, and as an anti-fibrotic substance. The anti-inflammatory properties of milk thistle are attributable to its ability to regulate cytokines responsible for inducing inflammation. Milk thistle has been shown to downregulate and inhibit the expression of COX-2, a key mediator of inflammatory pathways. Silymarin also inhibits the transduction cascade controlled by NF, and this protein complex induces the expression of pro-inflammatory genes responsible for encoding cytokines directly involved in the inflammatory process. It also regulates the survival of the inflammatory T cells. Studies done on mice show psilocybin reduces the liver and plasma content of pro-inflammatory cytokines while increasing the cytokine whose function it is to decrease and regulate the inflammatory response. Milk thistle has also shown antioxidant properties in the hepatocytes and can inhibit free radicals derived from the metabolism of toxic substances such as ethanol, acetaminophen, and carbon tetrachloride. This herb stimulates protein synthesis by protecting cell membranes from free radical-induced damage and directly inhibiting radical formation. Milk thistle can also act as a free radical scavenger and increase the intercellular content of scavengers. Studies have shown that milk thistle increases superoxide dismutase activity and serum glutathione and glutathione peroxidase levels. Psilocybin can also act as an iron chelator, further strengthening its antioxidant properties. In addition to its anti-inflammatory and antioxidant properties, psilocybin also shows promise as an antifibrotic agent, which is attributable to its ability to decrease platelet-derived growth factor-induced DNA synthesis in cells, which inhibits the transformation of stellate hepatocytes into myofibroblasts. By reducing myofibroblasts, it indirectly prevents the deposition of collagen fibers that lead to the progression of liver injury. Finally, psilocybin has demonstrated an association with a significant reduction in the key regulator in the pathogenesis of liver fibrosis. Pharmacokinetics, absorption. Small studies have demonstrated that flavonolignin are rapidly absorbed and eliminated after oral administration of standardized milk thistle extract. Distribution. Pharmacokinetic parameters appear to indicate a dose-dependent volume of distribution of some component phytochemicals in single-dose escalation assessments, with some of these compounds only detectable at the highest dose. Metabolism. Research indicates that silymarin extracts undergo extensive metabolism. Most of milk thistle's phytochemicals are subject to phase 2 hepatic metabolic processes. Other research also concluded that since milk thistle flavonolignin are extensively modified following oral dosing and are recovered in the urine as sulfo and glucuronyl conjugates, this analysis demonstrates a strong link to hepatic phase metabolism. Elimination. The parent compounds found in milk thistle and their metabolites may enter the internal circulation and are excreted in the bile or urine. Milk thistle flavonolignin metabolites are recovered in the urine. Administration. Available dosage forms and adult dosing. Like most herbal supplements, milk thistle is orally administered and available in capsules, tablets, or as a liquid extract containing ethanol extracted silymarin in doses of 250 to 750 milligrams. The daily dosage varies, but the typical dose frequency is 2 to 3 times daily. Research shows that silymarin is generally safe in humans at standard therapeutic doses and is even well tolerated at higher doses of 700 milligrams 3 times a day for 24 weeks. Special patient populations. Hepatic impairment. Despite milk thistle's use in patients with and without liver disease, it has not been implicated in altering liver function tests or clinically relevant acute hepatic injury. Renal impairment. There is little evidence regarding dosing milk thistle in patients with renal impairment, and some research suggests milk thistle may be renoprotective also. Pregnancy consideration. Caution is recommended during pregnancy as more studies are needed on milk thistle and pregnancy, especially in humans. Breastfeeding considerations. Limited data indicate that silymarin compound in milk thistle are not excreted into breast milk in measurable amounts. Pediatric patients. No studies exist examining pediatric use of milk thistle as safe. Older patients. No data implicates milk thistle as causing problems in older patients. Clinicians should exercise caution and monitor older patients who take milk thistle. Adverse effects. According to pharmacological studies, it's recognized as a safe herbal product since taking it in a therapeutic dose is not toxic. Although rare, some of the adverse effects of milk thistle could include gastroenteritis, diarrhea, headache, bloating, and dermatological symptoms such as hives, rash. Oral silymarin generally has few, if any, adverse effects and is well tolerated even at higher doses. Milk thistle may prompt an allergic reaction in individuals sensitive to the Asteraceae compositae plant family, example ragweed, chrysanthemums, and marigolds. Drug-drug interactions. Milk thistle does not have any documented significant drug-drug interactions. However, since it does exert some effect on the enzyme system, it might affect certain drugs, including diazepam and warfarin. However, this effect is not potent or even moderate at recommended doses. Some researchers have noted an association between milk thistle and bleeding in patients on blood thinners. Caution is advised with narrow therapeutic window medications. Since milk thistle appears to be able to lower blood sugar, it may have an additive effect on other medications for type 2 diabetes. Milk thistle may affect the hepatic metabolism of rioxapine by inhibiting rioxapine glucoronidation. Contraindications. There are currently no documented contraindications to using milk thistle. However, there is little information about milk thistle's interaction with cancer drugs, radiation therapy, or other medications. Monitoring. As with most herbal products, there's no definitive way to monitor blood levels of milk thistle or its compounds, and little data is available on the therapeutic index of the supplement. However, silymarin has been shown to decrease the activity of cytochrome enzymes, glucuronidase enzymes, prompting healthcare providers to caution patients against co-administration of milk thistle and specific pharmaceutical agents. Toxicity. Asymptomatic liver toxicity in clinical trials performed on cancer patients has been reported. Researchers observed an increase in ALT and bilirubin levels. However, this observation was at extremely high doses, between 10 and 20 grams. Enhancing healthcare team outcomes. Research has indicated that milk thistle has the potential to reduce biochemical changes seen in patients with NAFLD, and multiple pharmacological studies have demonstrated why many consider the plant to be a hepatoprotective substance. Based on the data available, many believe that milk thistle represents a viable alternative for patients with acute and chronic liver disease, especially those with whom standard therapy has failed. However, more evidence is needed to establish milk thistle's short-term and long-term effects. Other studies have shown potential therapeutic effects such as anti-cancer, anti-diabetic, anti-Alzheimer, and anti-Parkinson's effects, so interest in researching this supplement remains high. Healthcare workers, including physicians, nurse practitioners, nursing staff, and pharmacists, should be aware that currently there's no firm clinical evidence to recommend this in the clinical setting, but providers must function as an interprofessional team to ensure that all care team members know what drugs and supplements the patient might take. Physicians, advanced practice practitioners, nurses, and pharmacists need to inquire about non-prescription agents that the patient might be using, and milk thistle would be included in this query as an over-the-counter substance. The pharmacist must consider milk thistle and other over-the-counter substances in their medication reconciliation and alert the rest of the team to its presence in the patient's regimen and any potential indications. Nursing staff should be aware of the pharmacology of milk thistle and document it in the patient's medical record, so all of the other healthcare team members can be informed. All healthcare team members need to make the patient understand that just because milk thistle is available over the counter doesn't mean that it's a totally benign substance. This type of collaboration on an interprofessional team is crucial to managing patient outcomes effectively.